My name is Ezekiel Oburu. I'm an orthopedic surgeon at the University of Nairobi. And today we're demonstrating various casts that we use in orthopedics. Specifically now we are looking at the lower limb. And we want to thank very much Kerubo here, who has agreed to be our patient today, or our model for this procedure. And my colleague here is Zach Kemingich. He is the one who will be demonstrating how we put this cast. We are going to start with a below knee cast. Now, the indications are quite a myriad. Number one, we use it for ankle fractures that are not that are stable. We may use it sometimes for patients who have got terrible ankle sprains that really need their foot completely rested. We may use it for other fractures involving the hind foot. We may use it for calcaneal fractures. We may use it for fractures of the talus if we are not going to operate on them. We may use it even for injuries that involve the midfoot. So there are quite a number of reasons why we may use it. We may also sometimes use it in patients who've had various forms of surgery. Maybe a patient has had an ankle fusion or an operation in the hind foot, and we still want time for the bones to consolidate. So we may use this, not initially, but later after we have removed our posterior slab, which we'll demonstrate in another video. We may proceed to a below knee cast. So over to you, Zach.
Okay, thank you. When you have now managing the injuries on the lower limb, already we have done the upper limb for those videos that you saw it. So now we actually now want to see how we can manage injuries or fractures on the lower limb. So we are going to observe several procedures for the lower limb. And actually lower limb is quite different from the upper limb. If you try to see the positioning of the patient should be in a table or should be in an examination couch. Then the limb should actually be hanging. So you see that gravitation. So you have to be very comfortable, the patient is comfortable, and then the limb is hanging because you need that gravitation. So your preparation is very important. Like now I want to do a below knee circular cast. So it's a cast that normally 2 centimeters just below the knee joints, then actually to the toes. So when you want to do a below knee circular cast, very important to prepare your materials. So for this one now we require various, basically for the lower limb you really require 6" of plaster of Paris. Same also to Softiban, you require a 6". So let's now do start by, we have our water. Water is very important. We need our lukewarm water. So we've already given our patient, sedation has been given. Pain management is very important in all fractures, upper limb and the lower limb, so that some of these fractures sometimes you need to be able to reduce and manipulate. But with good pain management, at least there will be little of much pain. So, for example, our patient, she has an injury on the fracture of an ankle, stable. So what we normally do, we start first applying Softiban. So just the way other procedures, observing 50%. So when you reach at around the ankle, I want you to observe very nicely. You're able to make sure that you're able to apply nicely. Observing 50% overlap, very important during this Softiban application. Same to the lower limb. There are these bony prominence. We have the heel, and then we have also the malleolus. So we also cut piece of Softiban. Then we are able to apply the heel, and then we are able to apply the malleoli actually. The malleolus here, we have the middle malleola and then the lateral malleola. So we have another piece here. So you can actually be able to apply here. It's very important, these are prominent areas. So when you're applying a below knee cast, ensure the positioning of the foot. There are those injuries you need to put in a plantar flexion. Plantar flexion means, especially when you have an injury of the Achilles tendons, there are those injuries you need to put in a neutral position. So it's important which kind of injury that you are managing, so that you can now be able to position your foot and ankle nicely. So we want to apply, same, the cast should be dipped, 2, 4, 5, then remove it. Then now, it's always good to start from fracture side, very important, remember. Why we start from fracture side is to be able to control that movement, to relieve the pain. So we do below knee, you do below, you start from fracture side, going distally to proximal. So same, don't tight. There is always complication of a cast. The moment you tight, you'll always experience tightening of a cast, and you see when the plaster is tight, there's a complication to bring the cast to be removed. So where you stopped, you continue from there for uniformity. It's called the uniformity of the cast. Then don't go beyond. There is this nerve, which is the peroneal nerve. Ensure don't go beyond peroneal nerve, the circular, the lateral aspect.
So it's really passes just below the neck of the fibula head. So you want to ensure you're below that.
So when you apply like 2 rolls, you just need to be able to mold. Then probably you need just to correct. If the injury was maybe at the medial or the lateral, just give a nice molding. Then position your foot, should always be in a neutral position. Mold using your palm. Then my colleague, we always after that you'll be able to prepare a walking slab. So we'll get a piece of plaster there. Then prepare a walking slab.
How long do you want it?
Yes.
Up to there?
Yeah, correct. Yes. It's also good to prepare that walking slab.
Yeah, this is a good trick that enables you, because one of the things that you find out is when you've applied a cast, is you find that the patient has gone with it and has worked with it, and below there it's completely worn out.
Yeah.
So when you apply this, and also the other thing that this stops you from doing is you find people have applied a very heavy cast.
Yes.
So this is a good trick that I was shown many years ago, and it stops you from applying a cast that's way too heavy.
Actually, what used to be done is, used to be using the walking foot, but nowadays we're just using a walking slab. So you put that one, and then now get another plaster of Paris. Same, dipping it at 45 degrees. Allow some purples come out. Squeeze it. Then you start from distance here. Ensure you're able to expose because of the circulation. Yeah, so make it firm. Not too tight, at least. Make it firm, make it firm. Then you have to be very fast. POP normally set very fast. So you should learn to be fast. So still, continue to mold. Continue to mold, correcting any angulation, any deformity, any displacement. Then you wait for it to be able to set. So there is this called the setting time, and there is what is called the drying time. So for now, this is a setting time you allow it for it to be able to set. But for a complete setting, it's around 72 hours, when the cast will really be very hard. So those are things to be able to remember. Yeah, so you mold, give a nice molding. It's called a party going, because she might be going for a party and she needs to go with this cast. Then some can actually be able to give a nice.
Yeah, one small trick that sometimes you can use that I learned when I was a registrar is you can actually take this and you can dip here, and you know you smoothen it.
Exactly.
You use.
gives a nice and good.
Smooth, yeah. That people can sign on.
Exactly. So having finished the below knee cast or below knee circular cast, you wipe, clean, give proper instructions, ensure you don't really go beyond that because you need to be able to circulate that. So
You see the toes.
yeah, the toes. So give instructions is how it's supposed to. This one is basically stand-made bearing. It's supposed to use crutches. So it's very important for your patient to have 2 crutches. Do a check X-ray, then to be followed up until the cast is removed.
And explain to the patients the usual thing about cast care. They shouldn't put it in water. They shouldn't. They should be careful if they're in a lot of pain, if they have numbness, and what. If it's a child, a cast should add comfort to the child. If the child is not comfortable after the cast, really you need to come back to the hospital, and then we can do what? We can check it again. And always don't forget to clean your patient after.
Yes.
All right, thank you very much.
That is below knee circular cast.